My name is Sharon Vaipou, and I'm a development coordinator at HealthPoint. What inspired me to start to be in healthcare is my little brother. He was born with CHD, which is congenital heart defect. Seattle Children's was actually like a second home to me. So I can navigate my way through that hospital like it's nobody's business. What seemed to be like a traumatic time or, being there for months, he had multiple surgeries. It's the healthcare with nurses and MAs, they become your family almost. That grew something in me to want to have that same heart to serve other people and help them too. And that's when I found HealthPoint. I didn't know what a community health center was. So getting to learn more about how we're a nonprofit and just the mission alone, that's how I ended up here and stayed here for almost 8 years now. So I started to volunteer. I was doing the event planning for all staff. I started my first time to volunteer for Kaleidoscope, and I fell in love with the work there. In my family as the oldest, I feel like as the oldest daughter or just firstborn, you are the project manager of your siblings. So it just came naturally. But in this role, I feel like I'm still helping patients, but just in a different light. This field, you have to have the right heart to do this type of work. And when you have it right here and here, those two things together, you're able to create beautiful work, and you do the work. No matter how tedious or tiring it is, it makes it worth it. It's the why behind the work we do. There's a lot of cultivation work that goes into this. You have to have patience to work in development. It's not something that's transactional, that boom, boom, done. It's something that you plant a seed, you nurture that seed. It starts to grow, you continue to nurture that. One of my favorite things about working at HealthPoint is working aside other people who are like-minded. Iron sharpens iron. So being able to work with people who are just as mission-driven and believe that everyone, deserves great care, it makes the impossible possible. I think that's my biggest thing about being a part of the development team is the heart we have to continue the work outside of clinic walls.